The Omicron variant of concern is currently spreading with unprecedented speed across the EU-EEA. We are now seeing infection rates 3 times higher than at any previous stage of the pandemic so far. This is resulting in significant pressure in many countries around Europe through a combination of increased hospital admissions and staff shortages due to illness. There is a growing recognition that the extensive preventive measures mandated across the EU are coming with heavy societal and economic costs. Therefore, we proposed options for adaptation of such measures. Despite the very high intensity of virus circulation in the community, countries with very high vaccination coverage are seeing less impact in terms of ICU admissions and mortality than in earlier waves. This shows the impact that COVID-19 vaccines are having on preventing severe COVID-19 disease and death. In order to successfully enable a transition into what may be a post-acute phase of the pandemic, efforts should continue to increase uptake of the primary vaccination course in individuals who are currently unvaccinated or partially vaccinated. There is evidence that vaccine effectiveness against symptomatic disease after primary vaccination is significantly lower for Omicron than compared to the Delta variant, and that the effect wanes more rapidly. However, the booster dose substantially increases vaccine effectiveness against hospitalization, severe disease, and death. Therefore, all eligible adults should also be offered a booster dose. Modeling by ECDC estimates that the uptake of boosters that has been achieved by early January may reduce future Omicron hospital admissions by 500,000 to 800,000 across EU-EEA through restoring higher levels of vaccine protection. And if booster programs are extended to all previously vaccinated individuals, it could reduce admissions by another 300,000 to 500,000. In addition to continued rollout of vaccination programs, the maintenance of key non-pharmaceutical interventions is crucial over the immediate future. These include physical distancing, consistent and correct mask wearing, avoiding crowded situations, teleworking when possible, staying home when ill, and maintenance of hand and respiratory hygiene together with good ventilation of indoor settings. Countries where the Omicron variant has not yet become dominant or where it has recently become dominant should rapidly prepare to face a period of heightened pressure on their healthcare systems and their society as a whole. It is particularly important that these countries immediately strengthen the implementation and adherence to non-pharmaceutical interventions. The pandemic is not over yet. We need to continue with individual and group efforts to ensure that we all are safe.